Welcome to This Week Health Community. My name is Bill Russell. I'm a former CIO for a 16-hospital system and creator of This Week Health, a set of channels dedicated to keeping health IT staff current and engaged. Today, we have an interview in action from the 2023 fall conferences of Chime in San Antonio and Health in Las Vegas. And we want to thank our show sponsors who are investing in our mission to develop the next generation of health leaders. And they are Olive, Rubric, Trellix, Medigate, and F5. Check them out at thisweekhealth.com. And here we go. Another interview in action from the Health 2022 conference. And we are here with Paul Muret with Google Health.
Yeah.
Looking forward to the conversation. You guys were just on this stage behind us.
Yeah.
And it's really interesting. It's something we've known all along. The power of Google is to simplify the heck out of things. There's this massive internet, and you just put up one little box on a page and said, type in whatever you want, and all of a sudden we could get to whatever we wanted on the internet. Now you're doing the same thing for the medical record.
Yeah, it happens all the time. So we've had use cases where a clinician is admitting a patient for chest pain, and the patient was recently at a cardiologist and had a valve analysis done, but they couldn't remember the name of the cardiologist, they couldn't remember when that was, and for sure it's in some other system. And so this doctor would love to have the information right then and right there, but that is going to be a serious hunt to go find that. So the ability to simply type in cardiology into a search engine and have it instantly find a scanned PDF document from another system that pulls up a document that says, hey, here's the ejection fraction analysis, the valves and all that stuff, lets them take care of health in a faster way and more accurate. So we're really excited about the ability to bring search technology to this industry, which is so important.
So this announcement was MEDITECH expands to clients, and you're going to market. Now I stopped in your booth because I wanted to see it, but you did a demo here, but I saw the same thing where it was essentially you put in whatever and it's searching through all sorts of data.
Yes.
And it's highlighting it in the PDF. If you search for certain things like a certain reading or whatever, you could potentially see a graph showing
that's right.
the information you're really looking for.
Yeah, if you're searching for something that's like a vital or something in a lab, and we've got a historical trend of that information, or you can search for two of them at the same time, and it'll actually map them on the same timeline to show how maybe a medication and some other vitals are changing. So it's pretty interesting to see how fast the search is, but also to make sure the search result is extremely relevant for what the use case actually is.
So I understand how relevance in a search engine optimization for relevance.
Yeah.
Do we do that same kind of stuff for medical information so that it knows this is more relevant than this information?
Yeah, actually this system is effectively doing ranking of information to make sure that it pulls the top elements, the things we think are really high confidence, the thing you're looking for, to the very top, but then also provide a comprehensive list of everything we found. Sometimes it's important for clinicians to be able to go through comprehensively and see everything that has to do with our condition or something else. And so we want to make sure we actually serve both.
It's kind of interesting because the screen for MEDITECH expands is MEDITECH expands, and then you just see this little Google thing over here.
Very small, yeah, but it's a lot of power behind that.
It's amazing how much power. I mean, you just type something in, all of a sudden all this stuff comes up. But it comes up in a way that we're used to seeing now after years and years of using Google. In some cases, it's just popping everything up and putting it in a nice ordered list for us, and even categorizing some of those things. But then in other cases, it is popping up the actual data in PDFs and other
sometimes in regular search on Google.com, that happens as well. So if you search for a location or something on Google, sometimes we'll give you a little window or something like that. So depending on what the information is, we'll try to present it in the way that makes the most sense.
What is required to do this? This is the age-old question with Google. It's like, does it have to be hosted on Google's platform in order to make this happen? Because MEDITECH Expanse is hosted on Google's cloud platform.
Yeah, so we have a special HIPAA-controlled environment for MEDITECH to make sure that they're in total control of the data that they provide and work with their customers. And then we have the search capability is a series of systems that are medically tuned. So we take the kind of raw technology from Google Search, and then we actually process it further to really help make sure it can understand medical terminology, abbreviations, concepts, to really understand all the relationships between various things, and also bring in the NLP capabilities to make sure we can understand scan documents, and to make sure that can then operate on top of the data that MEDITECH has within their cloud secure environment.
Yeah, I think anyone who's in healthcare understands that you're operating separate environments. It's not.
Yeah, it's required.
Yeah, it's absolutely required.
Yeah.
But at any time this gets outside, people are like, oh my gosh, my health record's gonna, and there's absolutely no way for that to happen.
Absolutely locked down.
Since Expanse is hosted on a Google Cloud platform, when I walk through your booth, there's a whole bunch of other ancillary kinds of things. Does it enable some of those things? Maybe future partnerships?
Yeah, so there's so many areas of innovation within technology and health.
The one I'm thinking of is just Google Search in general.
Right.
So many health encounters start on the Google platform.
Right.
We've heard this over and over again. It's like the first place I go. I was talking to somebody during the pandemic about analytics, and they said, we could almost predict where the next outbreak was going to happen because of the search criteria. Because when people get sick, they were like, hey, I'm having these symptoms. And when you saw a bunch of those, you go, hey, something's happening in Seattle, or something's happening over here.
Exactly. So when we think about Google Health, there are really three main areas of effort. There are consumer-oriented efforts via search, YouTube, Fitbit, those kind of systems. There are clinician-facing efforts like Care Studio and Cloud. We're really focused on more of enterprise and provider. And then there's actually the community aspect, which is so important. Obviously, we've been working with government organizations, policymakers, but also be able to provide a view of what's going on in the community to providers, private organizations that need information. So for example, you touched on the symptom search functionality, which is fantastic to understand on a regional basis if something is going on in Nashville that you know about versus something that's going on in Fresno in California. So understanding the trending and the background of symptom search that's going on in different regions can be incredibly important.
All right, we'll get back to our show in just a minute. We have a webinar coming up on December 7th, and I'm looking forward to that webinar. It is on how to modernize the data platform within healthcare, the modern data platform within healthcare, and I'm really looking forward to the conversation. We just recorded 5 pre-episodes for that, and so they're going to air on Tuesday and Thursdays leading up to the episode, and we have a great conversation about the different aspects, different use cases around the modern data platform and how agility becomes so key, and data quality and all those things. So great conversation, looking forward to that. Wednesday, December 7th at 1 o'clock. Love to have you join us. We're going to have health system leaders from Memorial Care and others. CDW is going to have some of their experts on the show as well. So check that out. You can go to our website, thisweekhealth.com. Top right-hand corner, you'll see the upcoming webinars. Love to have you be a part of it. If you have a question coming into it, one of the things we do is we collect the questions in the sign-up form because we want to make sure that we incorporate that into the discussion. So hope to see you there. Now back to the show. The thing I see that's powerful though is everyone keeps talking about experience in healthcare, and the experience is disjointed and whatnot. If the experience starts on a Google search, it would be nice to have that completely integrated to the point where they essentially get the appointment, find what they're looking for, find the physician, get the appointment, go, have the experience that they have there. I mean, you can see Google getting integrated into that entire continuum back and forth and potentially smoothing out that whole process.
Yeah, I mean, we want to be incredibly helpful. That's like our main objective here in healthcare. And your point, there are many key moments that really create a lot of confusion and, let's say, gaps and friction for people to actually move forward. So, I mean, one key area is that consumers and patients often don't know what something's going to cost, where was this covered or not under my insurance, etc. So one of the features we've been adding recently to Google Maps is when people are searching for providers of a particular specialty or a lab or something, that we'll start to pull up insurance coverage information. They can see, hey, this is covered by Medicare, or this is covered by Medicaid, or this is covered by Humana, or something like that. And that's incredibly important because too often people don't know or are afraid to take the next step because because of the financial implications. So we're trying to help provide not only information, but then make it tailored to people's specific situations.
This is fantastic. So the first 2 pilot sites, MEDITECH expands. How long do you think that'll go before we start to see that move out from there?
Yeah, so it'll take some time. We have a couple other pilots also outside of the MEDITECH environment. We really want to make sure that we create something that is really thoughtful and really thorough, has all the right information at the right time. We understand exactly where it should be used and how. So it's really important for us to go through these pilots and do this right, to make sure we really dot the I's, cross the T's, so that when we're ready to start expanding, that we have a foundation of experience and proof points to really show how valuable this actually is. So it'll take some time.
Well, Paul, I want to thank you for your time. It is really loud in this hall right now.
It is loud.
So,
Bill, hopefully the mic's picked up all the conversation.
I appreciate it.
It's a pleasure talking to you.
Another great interview. I want to thank everybody who spent time with us at the conferences. I love hearing from people on the front lines, and it is phenomenal that they have taken the time to share their wisdom and experience with the community, which is greatly appreciated. We also want to thank our channel sponsors one more time who invest in our mission to develop the next generation of health leaders. They are Olive, Rubric, Trellix, Medigate, and F5. Thanks for listening. That's all for now.